Thank you. My name is Beth Poppich, and I am an advisor for OACB Children and Families. And along with my colleague, Susan Jones, who's also an advisor at OACB, we welcome all of you here. We're all excited to hear from our state folks and from the governor's office. So thank you all for being here. We want to start by giving our panel an opportunity to know who you are. So if you are in early intervention, can you raise your hand? Okay, you got a lot of EI folks here. If you're an SSA, we raise your hand. We've got a few SSAs. Great, good. Again, our theme is cross-pollination, so we're trying to get as many folks from county boards in one room as possible. So we're excited about that. Did we say superintendents? We have some superintendents. Thank you. Do we have any business managers? They're afraid to raise their hands. They are really, oh, they're in front. Oh, okay, okay. What am I missing? Who am I missing? Adult services folks who want to come in here. Oh, you can raise your hand proud. That's good to come and learn about early childhood. Anybody who, we have our state representatives from DODD, of course. And so thank you all very, very much for being here. I'm going to introduce Diane Fox, who a lot of you know, and then Diane is going to introduce our panel. Diane Fox is the Assistant Deputy Director of Early Childhood Initiatives at the Ohio Department of Developmental Disabilities. One of these initiatives is Ohio Early Intervention. She leads a team of EI professionals who carry out the Part C lead agency requirements. Diane is involved in numerous cross-agency work groups devoted to improving policy, services, and supports for young children with disabilities. Diane has worked in the field of EI for over 30 years with experience providing policy leadership, social work, service coordination, and special instruction services on a transdisciplinary team. She holds a master's degree in special education from West Virginia University with a focus in early intervention. She is a licensed social worker and certified developmental specialist, evidence-based coach for one-year DSs, and certified fidelity coach through FIP. And just before I turn the microphone to Diane, I want to remind all of you that you all submitted questions. OACB has collected every single question that you've had since the new department, the proposed new department was mentioned, and we've collected many of your comments in addition to a survey that we sent out to all of you. So thank you to those of you who responded, and the panelists have those questions, and that's you also have cards on your table. If we anticipate using the full hour, but if you still have questions at the end, write them down, and we will do a FAQ and get that out to you. So thank you very much.
Thank you, Beth. Appreciate the introduction. And now I have the pleasure of introducing our distinguished panel who will answer your questions about the proposed new Department of Children and Youth. Our panel includes 3 leaders who are strong advocates and passionate about serving children, youth, and their families so that all children have the best chance to live, play, learn, and thrive. Our panel includes Kara Wente. She was appointed as the director of the Governor's Children's Initiative by Ohio Governor Mike DeWine in January of 2023. Prior to her appointment, she served as the Chief Operating Officer for Future Ready Columbus. With more than 20 years in dedicated state service, she has extensive experience in serving the most vulnerable children and families in Ohio, including leading at her time as the Assistant Director of Health and Human Services at the Ohio Department of Job and Family Services, and led several large-scale system and policy changes as Deputy Director at the Office of Family Assistance. Director Hauck was appointed as Director of the Ohio Department of Developmental Disabilities in January of 2022 by Ohio Governor Mike DeWine. Director Hauck previously served 4 years as Chief Policy Officer at DODD and 4 years as the Assistant Deputy Director for the state's Early Intervention Program. She began her career as a direct support professional, providing services for people with developmental disabilities. She then joined the Hamilton County Board of Developmental Disabilities as a special education teacher and early intervention specialist. She also served in various other positions throughout her 22 years with the board, including Director of Children's Services and Director of Program Services. Throughout her career, Director Hauck has been an advocate for Ohioans with disabilities and their families. Dr. Wendy Grove is the Director of the Office of Early Learning and School Readiness at the Ohio Department of Education, where she helps develop and implement policies for preschool special education and early childhood education. She oversees a team who is responsible for licensing Ohio's public preschool programs and other early childhood special education programs. Wendy is dedicated to strengthening the systems that support Ohio's youngest citizens. She works closely with colleagues across state government, advocates, and associations whose programs benefit early learners. Wendy also spent 7 years overseeing Ohio's Help Me Grow home visiting, early hearing and detection intervention, and early intervention programs. It is my pleasure to introduce Kara Wente.
Thanks, Diane. You guys want me to stand? Because I can't really see y'all in the back. So if you're making faces at me, I probably need to be able to see you. I'm going to stand over here on the side and move closer to the door since I don't know this group. I jokingly said, you put the table all the way on the other side. So now I got to run really far if I say something y'all don't like. So thanks for having us here today. I appreciate the opportunity to come and talk about the new department. Know that you all have a lot of questions. Know that you all are wondering what it means to you. So we're going to try to give a little bit of background around not only the new department, but the investments and how we got here. But I have to start by saying thank you. So when we have conversations around the new department, some of that stems from ideas around service coordination and better serving families. And what you should know, what you probably already know, is that Director Hauck and Diane and their teams continue to say what a great job you already do. And how do we take those lessons learned and apply those to more families so they can get served in a new and a better way. We don't want to change you all from being service delivery. Don't think that you're off the hook in any way in that space. We really want to take what you all are doing and figure out how to expand it. So with that, I'd like to flip to a PowerPoint here if I can find the right button. And start with Governor DeWine. So Governor DeWine will tell you that his story has been kids, it remains kids. His focus is on how do we make sure that every child not only reaches their full potential, but that they get to live their version of the American dream. That means we need to meet them where they are. What that also means is that we have to have a plan to get them there. What we know and what stems some of this conversation around the new department is we've had more money going in to our child serving programs. We've had more focus on our child serving programs. We are very fortunate that we have a governor that likes to talk about kids, likes to talk about the programming, and wants to do better. And I will let you rest assured, he is not going to rest, which means none of us will either, until he sees us moving in the right direction. When we look at the data and when we look at the reports that we're seeing around child overall well-being and health, even with these investments, even with this new focus, our numbers are going the wrong way. And not only do we have to do this for our kids, We have to do this so we can continue to be on the cutting edge of economic development, that we can continue to be a leader nationally and globally in all things happening in our workforce, in AI, and pick a field, pick an industry. So Governor DeWine has had this focus since he was the Attorney General, probably since he was in the Senate, actually. And in October, hopefully you all heard that he relaunched a Bold Beginning plan. He wanted to focus on healthcare access and improving care, adoption and children's services, family supports, and literacy. And you saw this reiterated in his State of the State. You saw this really putting our money where our mouth was in the executive budget proposal. So I want to talk a little bit around what we see coming as investments and then get into more details on the department. So when we talk about healthcare access and improving care, you've heard us talk a lot around Medicaid expansion. When we talk about the new department, it doesn't mean that this work stops. It doesn't mean that our focus on new programming, expanded programming, and better serving kids is going to hold to plan. You're going to see us continuing to create new opportunities for healthcare coverage. You're going to see us working to expand Medicaid in schools, and we're going to do this by leveraging evidence-based practices. You see the AIMS bundles on here, making sure that our birthing hospitals have evidence-based practice access to some of the most critical care. So hemorrhages, diabetes, those things that we know we're losing infants to every year. We also wanted to focus on family supports. So you see us increasing funding and focus and continuing to move forward and help me grow home visiting, and improving screening for prenatal and postpartum depression, expanded safe sleep initiatives, more cribs, more peer-to-peer mentoring, more smoking cessation. We're looking at expanding housing supports. We've put some money in the state budget to support Healthy Beginnings at Home. There's a pilot now. We want to expand it. We want to make sure that moms expecting babies or with babies under 1 year have a safe place for them to live. If they don't know where they're going to sleep, it's really hard to talk to them about anything else going on in their lives. We want to expand childcare access. Right now, the House version still has in the expansion to 160% of the federal poverty level. We believe that that would assist and help an additional 15,000 children having access to quality educational experiences while their families are at work. And then also expanding the early childhood education program ran by ODE and making sure that we have more access to public preschool. In addition to healthcare and family supports, Governor DeWine, immediately after taking office, created the Children's Initiative. He gave a specific focus on children's service transformation. Although we have made great strides, we came up with 37 recommendations. We heard from more than 500 people. He is still not done. We are still not done. We still have kids sleeping in lobbies. We know that we need to have more placements. We know that we need to have better prevention. So in this budget, you see us also focusing on those investments. What I have to call out on this slide is also expanding the fatherhood programming. We want to make sure that those fathers know their rights. We want to make sure that those fathers know how to engage. We know that that takes curriculum. It takes time to spend with them on how to build those relationships. We've doubled that investment in this budget. And you probably haven't heard a budget conversation around kids. And I know you're probably wondering, what's the difference? What are you considering a child? What are you considering a youth? Why isn't family in the new department name? I will tell you there were many versions and many topics considered when looking at a new department. We didn't want to add family because we'll still have job and family services. We wanted to have children, but we wanted to make sure that people understood that those children could be 21. So we expanded to youth. Because when you start to engage with children's services can actually serve those kids up to age 21. So when we go back to literacy in this conversation, this is where we can start looking at outcomes. If we're better stabilizing, if we're better preventing, if we have the right curriculum in schools and we're supporting our teachers in a new way, we should start to see our literacy scores go up. We should start to see more kids enter kindergarten ready to learn. We should start to see better third grade scores. So we're hoping that this is a holistic approach to serving our kids and ultimately our families. and that we're going to start seeing the supports and the expansion and the numbers going in the direction we need. However, what we also know is we've had more money, we've had more focus, and yet those numbers aren't going the right direction today. So what does that mean? Yes, we're proposing a new department. And someone explained to me earlier this week that they're like, this doesn't happen very often. The last time was 12 years ago. The time before that was 25 years ago. And we understand this is a big ask. We've looked at what has happened in previous administrations. So under Governor Strickland, we looked at doing a center under the Department of Education. Under Governor Kasich, they created an early childhood officer. Governor DeWine started with a director of children's initiatives. But when you have someone that can help prioritize and convene, but not on policy, but not prioritize on funding, and not prioritize and hold accountability at the forefront, you're a little limited. So what we wanted to do is the same thing we've done for veterans and those with mental health and addiction issues, is we want an agency to wake up every morning and say, how can we better serve kids? And how can we make sure that we're building awareness? How can we make sure that we're pushing our end result outcomes? How can we improve transparency and accountability? So what the new department will be focused on is combining programs under one roof, looking for duplication at the state level, and trying to really look at our programs, not from a check the box, you became eligible, you got supports, you hit your age eligibility, or you won over income, and now we're done. Because when we do that, some families aren't ready to be done with that service, and they need help figuring out what's next. And when we don't help them figure out what's next, we can pay twice to help that child, to catch that child up. So the goal is to streamline services, to eliminate duplication, to increase administrative efficiency. There's several questions, and I don't want to steal too much thunder, but we don't want to create an entire new fiscal infrastructure for a new agency. We really want to lean into what we see working. So what you're going to hear us saying is the new department is estimated to have and I'm going to give a very precise number, 577 staff. And those 577 staff, people then said, well, is there anything left in those agencies that you're taking these staff from? The highest percentage of staff coming from any one agency is the Department of Job and Family Services. It's 17% of their headcount. That's a lot of people, and it's a lot of movement. But what we want is all of those people to understand that they are not focused on the beginning and the end of that program. They're focused on how is the family going to interact with us? And how are we going to better, like you all do every day with service coordination, how are we going to do a better job at the state level when we get those calls, or when we write that policy, or when we provide that training and technical assistance? So one of the other things I really want to highlight before we get into Q&A is the timeline. We do not stand here today to tell you that we have all the answers on the new department. What we can tell you is we see a need. We know that what's happening today can't be the best we can do, and that we want 18 months to work with you all, to work with our teams to figure out how to do this right. So from the fiscal perspective, we want to be able to have the conversations around transition of a grant or an allocation. We want to be able to have the conversations around what works best when we talk about public awareness. We're not trying to, someone asked me, they said, so are you just going to put everyone in every benefit you have? Absolutely not. That's not the goal. The goal is to meet the family where they are and to anticipate what comes next. If you're about to age out of early intervention and your child may need more support, what do you need to do next? That's one example that you all work on every day, but no different than when we look at home visiting to publicly funded childcare, or even in our licensing space. One of the questions we have a lot is, well, you're going to combine all these licensing staff. We will cross-train, we will try to build capacity, but when you look at the draft front page of a TO, it doesn't mean we're just going to throw them all together and think that it's exactly the same. But what we want to be able to do is where we have individuals that are really great foster home inspectors. Well, they may also be really great family childcare home inspectors or quality assurance measures. So there's some examples in the space where we think we can better leverage our team. A lot of conversation has been around where do these programs fall? And I think when it comes back to stakeholder feedback, the reason you see a couple of these highlighted, this isn't probably a version you've seen. We've been working on this with the team and got really great feedback around the fact that, you know, children's services isn't really a support. Children's services should be moved up because it should be identifying when a family needs more support and how do we support them in a new way. When we talk about early intervention, that's really helping build a child's development and meeting them where they are. It could really be seen more on the education side of things. So we're starting to look at where do these systems align, and why you see them highlighted is because they've been a couple that have moved. And when we talk about the end goals, and before we get into the specific questions on the new agency, words you've already heard me say and words that will be driving forces of the new agency remain transparency. We need to have more data available. Some agencies do a great job of this. Some agencies can do more, but ultimately we not only need to look at what children are being served, we need to look at our workforce data. We need to look at how are they engaging and what happens when they leave our program. We need to look at accountability to make sure that the results that we believe we're getting when we use an evidence-based practice are actually being realized. We need to have focus and prioritization. Again, someone waking up every day asking, how can we do better for kids? And you see maintain local structure because this is something we believe at the state we can do better. That does not mean that there has to be a change at the local level. We are a locally driven state. That is not changing. And we don't want to require that. We don't want you all to leave this conference room today thinking that that's what we said. You all can do that at the local level because you get to decide and you get to partner. But what we believe at the state is that we can do a better job aligning our programs, aligning our resources, and ultimately getting better outcomes for kids. With that, I think it's time for us to turn over to Q&A.
You want me to go first? Okay, I get the first question. And this is for Kara Wente. So, and I think you've answered some of these questions with the presentation. What are the identified deficiencies that the new agency will address?
So I think we talked a lot around results, accountability, transparency. I think when we talk about deficiencies, it's really more along public awareness and communication that we want to improve at the state level.
Thank you. Why are certain child serving programs moving to the new agency and others are not? Examples, Ohio Rise, WIC.
So that is a question we have been asked a lot around Ohio Rise and WIC. And a couple of basic premises are we have to figure out what can come together in a manageable and successful way. WIC is a conversation that the new agency or children's initiatives is already involved with, but we can't bring it all under one roof at one time. So we wanted to make sure that we stand up what we're identifying first, really leaning into the early childhood space to start with expansion up to that age 21 because of children's services, and see if we can start to create that transparency and accountability.
What are the key steps and timelines for moving early intervention to the new agency?
So you saw on the slide the July 1 date of creating the new agency. I would say the first 90 days are going to be very critical to get stakeholder feedback and for the agency to actually have a director appointed, an infrastructure put in place, some transition teams identified. And then we will use the next 18 months to transition all programs. So between July 1, 2023 and January 1 of 2025, is when that transition would occur.
Thank you. This question is about the relationship between public service, children's service agencies, and early intervention. How might this new agency assist local county boards with addressing challenges with local public children's service agencies, such as sharing information to prevent families from having to share information over and over, and obtaining consents for screening, evaluation, and assessment when the child resides in foster care?
So that is one of the goals I should have highlighted on the PowerPoint. Really, data sharing is one of the key principles also that we believe we can do better when these programs get under one roof. So a great example is right now, when we want data from the 6 agencies, we have to have individual data sharing agreements from each entity. We are now working to try to streamline some of that, and the agency directors have been wonderful, but it's hard to get every agency on the same page at the same time when they all have competing priorities. So we do believe that we'll be able to do better data sharing, both hopefully at the family level, but also at the program level, so we can have more targeted investments and be able to tell the story that we know that we're getting better outcomes, and that we will as we continue to build public awareness and meet those families where they are.
Thank you. Director Hauck. Ohio has met IDEA requirements for the last 3 years. How will moving to the new agency support continuing this huge accomplishment?
Hi, everyone. First, I want to say it's been longer than 3 years. So congratulations to all of you. And, you know, it'll be the same way it is now, right? It's because of you and all of your hard work with families and the children that you serve that we are in the meets requirement stage for OSEP. So I wouldn't expect that to change or be any different because of a transition.
Okay. And Director Hauck, furthermore, how will county boards access technical assistance and training around Part C service coordination, specialized services such as special instruction, SLP, PT, OT? Currently, we have a regional consultant with experience, skills, and knowledge of IDEA Part C. Will that change?
I feel like I'm going to say, no, it's not going to change a lot for a lot of these questions, right?
Yep.
So at the state, your technical assistance team that you work with now will transition to the new agency. So you'll see the same faces, the same people. They will all be there to continue to support you, whether it's at DODD or at the new agency. It'll be the same regional consultants. And certainly, that early intervention is a passion of mine, and DODD will certainly be there to support the new agency as they move into this new role.
Okay, thank you. And I think that covered our next question as well. But again, Director Hauck, how will EI moving to a new agency impact service coordination grant agreements between DODD and counties?
Sure. So I think last time I looked, there are maybe 8 county boards that are the Family and Children First fiscal agent. So for the 8 that are the fiscal agent, you could potentially see some changes, right? So you would be maybe using a different grants management system. But for everybody else, FCFC would remain the same. For everybody else, you aren't the fiscal agent, so you aren't receiving the direct grant from the state. So it would be exactly the same for you, if that makes sense. So you'll see, again, very little change. You'll still have your agreements with your Family and Children First agent, fiscal agents. I always forget to put that part in there, and receive your funds from them just like you always have.
Director Hauck, to you again. This is about IDEA Part C service delivery. How does the new proposed department impact our current service delivery approach? I believe they're meaning the primary service provider approach to teaming. County boards provides most of the EI services. How will it impact system of payment and other providers? Will county boards need to change how they deliver their services?
So, I want to start by saying how proud I am of each and every one of you for transitioning into the evidence-based practices. It's been 15 years or so now that we started really changing the way we provide early intervention in the state of Ohio. And we are absolutely a leader in this space, and that is because of all of you. And that certainly will not change. I know that you all will continue to do the great work tomorrow that you're doing today. So I'll start with that. So obviously, the way services are delivered, we wouldn't expect any of that to change. System of payment will still be, there and available. The rules aren't going to change as far as, what's needed and the process to follow to access those funds for providers outside of the county boards. Let me see what else was on here. I expect things like early childhood mental health, hearing and vision, those things that the state is providing for teams now. We expect all of that to continue. Just because it's moving to the new agency, all of those contracts, grants, will all move over with the program.
Thank you. I have one more. It's around IDEA qualified personnel. Will the developmental specialist who provides special instruction under IDEA and certified through DODD continue to be certified through DODD? And there were a couple questions around would they continue to work at county boards, or will certification rules requirements fall to the new EI agency?
Yeah, so I would expect certification requirements to move to the new agency. However, I wouldn't expect them to change. The service coordinators right now already go through OCRA, the Ohio Child Care Resource and Referral. So certainly that wouldn't change at all. The developmental specialist, for example, may use OCRA, may use JFS, or we may lean into shared services and it may stay at the Department of Developmental Disabilities. We don't really know that yet. However, I do feel very confident in saying that I don't think the rule will change. So you will still have the same requirements to meet, the same standards as that have been set forward over the past several years. And the rules will go through the clearance process, public comments process. You'll continue to work on all of those things through the EI Advisory Council, just like you do today. None of that will change.
Okay, thank you, Dr. Hauck, or Director Hauck, and moving now to Dr. Grove. I gave you a Ph.D. Yeah, congratulations. Now, Dr. And will the real doctor at the table? Wendy, our good friend, Dr. Wendy Grove. So this is kind of a cluster of questions. What collaboration will there be between Part C and Part B related to transition, impact on the preschool rule, DODD rule, and those. Transition, I think, is the topic here, Wendy, from C to B.
All right. Well, I am having a very hard time sitting down.
Okay.
Hi, back there. Appreciate you all back there. Okay. So same answer as Director Hauck. We don't anticipate any real change to the rule, except that it might come under a new authorizing section of state law, right? Under a new agency. So, but of course that will take time. And so for right now, all of the rules that govern our preschool special education requirements remain the same. And don't ever forget, they basically restate IDEA. And so all of the requirements will continue at least until we would see a reauthorization or any changes that we don't expect or anticipate anyway. But particularly around transition, we will continue our work with OACB, who brings together and offers the C to B transition training, which has been hugely successful, bringing people together in person and working through those interagency agreements and who does what and all of that around the smooth transitions. We know it's not perfect. We have a long way to go, but I am excited to say that I think we have come a long way since we've had that available.
Thank you. And the next one is for Dr. Grove and Director Hauck. This is kind of broad, compliance under IDEA as it relates to transition. I guess the hope, we know there were some discrepancies and difficulties, but
Yeah, so I'll start. I think one of the great things about moving to the new department, and if you saw on Kara's one slide, not she, but like the group moved early intervention into the middle column, which was education. And you'll see that early childhood special ed is in that column as well. So they'll be housed together. They'll be able to, again, at the state level, work closer together around transition services and how what Part C is asking for and what Part B is asking for works together, and ensuring that we're giving consistent guidance out to both early intervention programs as well as special ed preschool programs.
Yeah, and just to continue on with that, our relationships don't go away just because we move. We have all worked together very collaboratively and well over many years now. And if our team moves from ODE to the new agency, as we expect that it will, then our relationships that we fostered with K-22 and special education at school age also do not fail. They simply have to change a bit, and we are all committed to making sure that those relationships are only strengthened and not weakened.
great, thank you. Dr. Grove, what impact will be moving to a new agency have on current teaching licensures for the early education programs moving to the new agency?
Yeah, so education, the Department of Education remains the agency who oversees teacher licensure. So we would not expect the licensure that happens under ODE to move to the new agency. However, the rules that sort of govern what lead teachers in preschool classrooms have to adhere to, and those minimum requirements will likely move to the new agency. So again, it'll be a collaboration. It'll be pointing you to those places in Ohio Revised Code that already lay out the requirements for early childhood educators with teaching licenses.
Thank you. This question is for both Dr. Grove and Director Hauck. It's around communication. What communication about the new agency has been provided to local educational agencies? And then Director Hauck, the same question to county board superintendents and to the field.
So currently my office offers twice monthly open office hours. And so hopefully you've heard of these. Maybe you have, maybe you haven't, but it's really a drop in 45 minutes twice a month where my team, representatives from every part of the programming that we oversee, are available to answer whatever question arrives. And we have gotten quite a number of questions about the new agency, which we answer to the best of our ability. And we do that again twice a month. If you are interested in dropping in and checking us out, we do have one actually tomorrow. Come on by. All you have to do is go to ODE's webpage under early learning, which is under topics. And on that main landing page for early learning, right at the top is the link that you need. There's no RSVP. There's nothing required to join. So that's where we have put most of our energy in communicating out directly to local education agencies. We also utilize our regional system of supports, which are the state support teams, as well as our educational service center partners.
So in general, there's been a fact sheet released. If you've watched, Kara has testified multiple times in the House and the Senate. I have talked to superintendents at the SEC meeting once or twice about this topic. We honestly have not put a ton out in writing yet because there just isn't a whole lot to put out yet. We're still waiting, obviously, for the budget process to work its way through. And as we learn things, we certainly will share them through our normal modes of communication, Memo Monday, Pipeline, Director's Corner, that sort of thing. There is a website, Bold Beginning, that there's a page dedicated on there that the governor's office keeps up to date as things become more firm and we know what's going on.
Thank you. The next question is for Director Hauck as well. And this is probably the most frequent question that was asked. And it's about DODD accreditation. If EI moves to the new department, will county boards be monitored by DODD accreditation? They're talking about EI, or only through the new agency, or both?
Great question. And I think, we will have an opportunity to talk about this at our EI advisory council meetings. From my perspective, and you all can tell me that I'm wrong, but I would think you would want to have one entity come to the county boards to do accreditation. And if that's indeed true, then DODD is absolutely willing to continue accreditation as is today. That doesn't mean that the new agency, just like now you have Melissa Quartz and Taylor Hammond and those folks who, do some monitoring activities specifically for OSEP and that sort of thing, that would all still continue as well. But we want it to be as smooth and seamless as possible. So, I will say I foresee it as being the same as it is today, but certainly can have that conversation.
Thank you. The next question is for the panel, so all three. And it's around early intervention system of supports. What is the vision for a smooth transition? When will the plan be shared? Who is making the decisions? And are there stakeholders involved, including the county boards?
I think, as Kara said earlier, the first 90 days after the budget will be really important. And absolutely, county boards will have a seat at the table to be engaged in these conversations. You're a huge stakeholder and important part of the process. And we wouldn't move forward without that. We will also ensure that families who have young kids with disabilities are included. And, I want to share, we have the Early Childhood Advisory Council, and we have a state superintendent or a county board superintendent, as well as a parent with a child who has a disability on that committee. And that just happened a few years ago. And it's a really big deal. Your voice is heard on the committee that reports back to the governor. And you should be really proud of that.
So just to add a little bit around some of these specific questions as well. Kim hit on the stakeholder feedback. Certainly that is something that you will see us working on over the next 30 days to get a plan together. And that will be the focus come July 1, once there's been a team appointed for the new agency. I think the other piece of that though is we're making decisions around what programs to move. What you also hear us saying is, we know we want these programs to work differently together at the state level, but we need your voices to help us figure out where you're seeing our gaps. We know it. We know there are some, but we know you're going to help us through that process and make it better. I think as far as the decisions being made, the governor is very hands-on. He has a very engaged team that's been with him for a long time. So when we talk about the programs moving and we talk about the why, those are instructed a lot among our cross-agency team. the experts that have been in the room over previous administrations, but certainly what you hear us talking a lot about is lessons learned. So we all know that you've been through a transition in the last few years. We certainly don't want to relive issues that we work so hard, you all work so hard to fix. So know that that is staying in the forefront of our minds as well as these decisions are made and planning is underway.
Okay, Wendy's fine. All right. The last question on our list is around central intake and referral. What will happen to the Help Me Grow branding? Will home visiting and early intervention be separated from the branding?
This question brings back nightmares for me. I mean, however many years ago it was, we had so many conversations during the last transition about the Help Me Grow branding. And if we thought it should stay for both programs, stay for one program, not the other. And at that time, we really decided that everybody knows Help Me Grow, that is the branding that people know and people relate to. And so all those conversations with many of you that I still see in the room, we decided that it was a great idea to keep it for both programs. And again, unless something significant has changed since that time, we would expect it to stay the same. But always willing to have that conversation if things in your community have shifted.
Okay. That is all the questions that were submitted.
Do you three, thank you so much. Do you have anything else you want to say that we didn't get to in the questions or?
I will add on to that last question. So I had the opportunity to work in a nonprofit in Franklin County, and we did a qualitative study with a national vendor. And when they did that work, they actually brought up a lot of different topics around what people recognize as a resource. And when you talk about Help Me Grow, that is actually the one component that people said that they not only recognized, but knew what it was. So I think, the work that you've done and the trials and tribulations you may have lived through were well worth it, because you're seeing that same sentiment be carried through in our families. But as you've heard Director Hauck say, and I know Dr. Grove feels the same way, we don't anticipate getting it 100% right the first time. But what I hope you hear we are committed to is we want to do better for kids. We want to maintain the investments that the General Assembly is continuing to give us. And we're okay to be held accountable and be transparent in that lens. But we know it's going to take your all voices at the table to help make sure that we get it as close to right the first time as we can. But we also will remain committed to continuing to get feedback through the process and recognize that we're going to have to continue to adjust. That is a commitment from the state partners, whether it's a cross-agency team meeting, the governor's office. I think stakeholder feedback is going to be critical, and recognizing when we need to course correct is going to be equally as important.
I'll just add, as we move, once the budget passes and we know what's really going to happen, and we move into that time of transition, please reach out to us. Please ask your questions. Don't take anything for granted, or I just really want, and I hope you all know this already, you to feel comfortable reaching out to me, Steve Beha, Diane Fox, any of us, or Kara and her team, to make sure that you really do have the information that you need. And certainly we will communicate a lot more as that time approaches.
I do have one more that's not on here, but I promise it's not a ringer or anything.
Wait, who's it for? We can take it.
It's for all of you. In the event that it doesn't pass the budget, Are there plans, however, to keep working towards the goals that the governor is interested in and that we will see an impact, hopefully for the positive, similar to what the new agency might? And Kira, if you need to say I can't answer that, that's okay. I
Oh,
mean,
no.
again,
I-
this,
Once the governor's made up his mind that something needs to
Oh.
be better,
Yeah.
we'll find a path
Yeah.
to make things better. I
Great.
think what his commitment has been is he is going to remain steadfast in his commitment to kids and he wants better outcomes.
Yep.
So whether it's this avenue or a different avenue,
Yeah.
he's not going to be okay with keeping it the way we are today because we're not seeing the results for them.
and I think I can speak on behalf of this group. We're so, we love that our community, we're very possessive, we admit, of babies and children with disabilities, and are really honored to be a part of his vision and be into the fold. So we look forward to that. And earlier, Director Hauck, not today, but a few months ago, said to all of us, EI in Ohio does set the standard for good quality services to families and children. I feel proud of that. And I think we have, as you mentioned, Kara, earlier on, I think we have a lot to share with other agencies and partnership with them. So thank you and for involving us and for taking the time to come here today. Means a lot, all three of you. Thank you.
I'm glad you heard that at the beginning because I know we have no favorite programs, but we do have
Yeah.
levels and expectations, and we want to leverage those that are getting good results for kids.
Yes, thank you.
have favorite.
Yeah, yeah. Yeah, we do too. We do too.
Director Hauck.
Yeah.
She's allowed to say that. I'm not. No.
Yeah. So thank you very much. We encourage you all, please, there are cards on your table. If you don't have one near you, just rip out a piece of paper, write it down, leave it on your table. We'll make sure the panel receives those and we will communicate that back out. Thank you, everyone. Enjoy the conference. Thank you, panel, very much.